Hello, Facebook friends. Today is Tuesday, December 3rd. It's Giving Tuesday. I'm Dr. Rita Roy. I'm the CEO of the National Spine Health Foundation. And today I want to talk to you a little bit about the foundation and the work that we do and let you know why we think our work matters and is helping many, many people around the country. A lot of people don't know the staggering facts about neck and back pain. About 100 million people in our nation are afflicted with debilitating neck and back pain every year. 100 million people. That's about a third of our population. Chances are you or someone you know is affected by neck or back pain. And we're here to tell you that there are solutions and there are treatment options and treatment options that work. I think one of the things that people face or deal with when they are told that they might need to have back surgery is that they feel fearful, they're confused. We even see people being depressed because there's still a lot of stigma around whether or not back surgery works. And we are here to say that for many, many people, for the majority of people who need to have back surgery, there is good news. There are new innovations that are helping people. They're helping people get better faster. I think one thing that most people don't know is that about 35 million people every year miss work days due to lower back pain. That means missed work days due to lower back pain are more than any other condition like the common cold, which is staggering when you think about it. And in looking for information on what to do to help your pain, a lot of times people don't know where to go. There's misinformation out there. They go to the internet. There are thousands of pages that pop up. And we at the National Spine Health Foundation are an unbiased, vetted source of information. Vetted means that we work with professionals, trained experts who look over the content that we produce and we put it out there. And our sole mission is to educate people who are suffering with debilitating neck or back pain. And it's by producing this educational content and making it free and widely available that we believe we are giving hope to many people who don't know where to turn for answers. When you have hope, you can get yourself off the sofa and really contemplate getting back to your life. And it's not until you know where to turn for that help. We want to be here. It's through the generosity of donors that we're able to produce programs like our Spine Talks program. Spine Talks is a program that we launched this year, and it really gave us the ability to go out to the nation's leading experts and have them join us in a conversation, much like I'm doing today. Just a conversation about telling people about treatments that work, telling people how to get back to their lives if they are faced with neck or back pain, and how to get better faster, what questions to ask your doctor. So take a look at our Spine Talks programs. We're excited to be rolling more of these out in 2020. So keep your eyes open and check out our website for more Spine Talks that are coming. One of the other exciting things that we do is we conduct clinical research here at the foundation. We've been involved in clinical studies with industry partners, and we do our own clinical studies with national research partners around the nation. One piece of news that I'm very excited to tell everybody about today is some of the findings that we are discovering through our ERAS study. ERAS is an acronym that stands for Enhanced Recovery After Surgery. And what it is a series of actions that healthcare providers take in the hospital to help patients get better faster after surgery. We call those actions a protocol. So the ERAS protocol is a series of ways of managing patients after surgery. So decreasing their opioid use, getting them to the bathroom faster, getting them to eat faster, and getting them up and out of bed, sometimes even in the same day that they've had back surgery, and going home very, very soon after surgery. These are all novel techniques and new ways of dealing with people who are having back surgery. We are very excited to say that we presented our first study just in September, this past September in 2019, at the NASS conference, that's the North American Spine Society conference in Chicago. And we have even more exciting ERAS news that's coming out in 2020 with abstracts that have been submitted to more meetings. So look for the National Spine Health Foundation to be presenting this really, really exciting groundbreaking work at conferences in 2020. So doing the research to prove that there are treatments that work is not inexpensive. And we are able to do that because we have had grateful patients give to the foundation. And on this Giving Tuesday, we want to say thank you to all those people who've given to us. It's helping us to make a difference in the lives of millions of Americans. In closing, I want to just remind everybody that the journey to spinal health is not one that can be made alone, and it is not similar to one another. Each person's journey is different. While there are some similarities, your journey to spinal health will be very different than the next person's. It is our job at the foundation to tell you what those differences might be and what to do about them. You might need more time in physical therapy. You might need more time with your doctor. Everyone's journey is different. Every approach to back pain or neck pain is different. And there are many, many approaches to take. When you come to spinehealth.org, you can learn about all of those approaches. And we can show you the data that proves what works for one and what works for another. I invite you to take a look at spinehealth.org. Look at our spinal champion stories. Each of these people are people who have overcome neck or back pain through a treatment that has helped them get better and get back to their lives. Spinal champion stories are so inspiring. And if you are a spinal champion, we invite you to come to spinehealth.org and share your story. Everybody's story is different, but everybody's story can inspire another person who thinks that their lives have permanently changed. And while everyone's recovery is different, we do know that most people will get back to their loved ones and to the activities that they love. In closing, I just want to say thank you again to those who have given to us and invite you to consider including the National Spine Health Foundation in your Giving Tuesday donations today and through the rest of the year. Thank you, and here's to good spinal health.